Hi, everyone. Thank you for coming on for another session on our Dental Shadowers platform. My name is Crystal, and today we have Dr. Julie Driscoll, who is a cosmetic and general dentist. We are so excited to have you on our platform today, and whenever you're ready, you can take it away.
Awesome. Thanks for having me. Let's see. It says the screen is being recorded. How do I? There we go.
You just have to hit OK. Yeah.
Yeah, now?
Yeah. Perfect.
Okay, awesome. Is it looking good?
Yeah, you're good.
Awesome. Just want to make sure before we get started.
Yeah.
Thanks guys for coming. I appreciate this. I think this is going to be a cool way for you guys to see maybe a different side of dentistry than what you have shadowed before. I hope that it is like inspiring in some way, to maybe a few people at least, to see a version of dentistry that is a path you can take. And I'll give a little bit about my resume, like where I came from, what I did with school. I know when I went to shadow and had lectures like this as a student, I wanted to know, like, what was your GPA? What did you do? How did you get in? That sort of stuff. So I know that's always a pressing information. So I'll get into that too. And then this is actually a lecture that I gave last week to dentists. But it's going to be kind of an overview of the actual content and not the nitty gritty. So you won't have to have any dental background to understand this, but hopefully you enjoy it. So that's my Instagram handle. I share a lot on Instagram. I think it's a fun way to learn and connect with other people that might want to be interested in this path. So that's honestly the best way to message me about dental things or questions. That way it's all in one place. So yeah, we'll get started. I started out with I actually clipped this from my resume. So quick facts, education wise, it starts at the bottom and goes up. So I went to College of Charleston. I'm from Raleigh, North Carolina. I went to College of Charleston in South Carolina. I majored in Spanish, and um, I'm pretty casual when I teach or talk. So if you have questions, type them in the chat and then we'll get to them. But if you can major in something other than science, the schools actually love that, because you're bringing a different flavor. You're able to relate to more people because of that. I mean, it's great to have your science degrees too, but they liked that I had a major that stood out. So something to consider. I went to then South Carolina, or MUSC in Charleston for dental school. And then I did a 1-year residency at UNC Chapel Hill in North Carolina. There's 2 different general dentistry residencies that you can do after dental school. It's optional. I explain it kind of similarly to like a fellowship of medicine. So it's optional, but it's like more specific training if you want to do it. So I did 1 year in education in general dentistry. And then I did a 1-year residency, which is pretty rare. Not many people do this residency with the cosmetic dentistry. So I work under a cosmetic dentist, and they're your mentor, and you basically shadow them at work 24/7, basically. But it's kind of a unique way to learn cosmetic dentistry. But I knew that I wanted to do that. So that was my foot in the door for that pathway. And then this kind of same thing, but now it kind of goes from the bottom up. I've had several associateships this past few years. I've been out of school for technically 5 years, but 2 of those were residency years, so 3 years. And I've had a few associateships. So I'd be happy to talk to you about associateships when the time comes for you guys, what to look for, what to look out for. And I'm starting my own practice this year. So a whole new learning curve on that one. I'm like negotiating leases, that sort of thing. So it's always a lot to learn. So that keeps it fun though. This was also like a clip from my resume with outreach that I did. Do a ton of volunteering, especially when I was in college and dental school. And that's, it's just boosting your resume, but it's also giving you purpose. So it's a win-win on that. And then as far as leadership things go, some of these are from college and then some are from dental school. It goes from the bottom up again. So I was super involved in clubs and organizations. Um, and hopefully you guys, if you're applying to dental school or have applied, you know that you want to be involved in organizations, but you also want to be having leadership roles and like truly committed to them. It's one thing to be in 20 clubs in college, and it's another thing to be the president of a club or co-president or secretary, even just showing that you're dedicated to something and that you can lead, because as dentists, you're essentially leading your office every day. So it's also going to build you into being a good leader and working through things that you're going to have to learn later in life if you don't learn them sooner. So these are some things I'm working on right now. So it never stops. I actually got my fellowship in the Academy of General Dentistry, which is basically a big test that you take. And then you have to take 500 hours of continuing education after dental school. So I like to learn, kind of a nerd. But that's one thing that I did after dental school, and that just sets me apart in my community as a dentist. Especially as a younger dentist, I'm able to distinguish myself as someone who's taken a lot of continuing education and passed this rigorous exam. So that's something to think about after dental school. And then I'm also in the process of becoming accredited with the AACD, which is Cosmetic, American Academy of Cosmetic Dentistry. So those are two things. I have my FAGD, the one on the left, and I'm working towards the other now. So what we're going to get into before we keep going, this is my real life things that I do for fun, not just school. I like beach volleyball, love to play beach volleyball. That's actually my family playing on the left in my neighborhood at home. And then that was in St. John, playing beach volleyball in a gorgeous, is the prettiest place in the world. And then I like to be active. I like to stay outside. I do a lot of art. Got really into macrame during COVID. And then I do a lot of mission work too. So that's kind of who I am as a person. And when you're in school for so long, working so hard, like the biggest piece of advice I can give you is to not lose yourself personally. Because it's easy to do so when you're so stressed out with school and so committed to so many other things that you have to remember your hobbies and your passions, because it's really easy to lose them in school. These are some other places I've learned, and that's kind of where I got the information from for this. But this is, yeah, like I said, a lecture I did actually this time last week for an association in Columbia, South Carolina. But I went through this like before and after case. So you're going to see all these before and afters, and there is so much work that goes into them that I want you to kind of see what I think and what I see and how I plan that. And it might not mean a lot to you right now, but it's kind of fun. It's going to be kind of a different way of thinking for you guys. So I hope you enjoy. So how do we get from here to here? So you can see a huge difference. Lipstick aside, we throw the lipstick on at the end because it's fun to do before and after dramatically. So how do we get from here to here? But then this is really the main thing. And she gave me permission to use her face, but how do we get from the left of someone that's like not smiling, freaking beautiful, but doesn't smile with her teeth, to someone that is glowing, using their teeth and smiling? And that's really, for me, what I found in dentistry to be my calling, because I'm able to see that artistic side of things and able to help people in a different way. So I listened to this book because it's Matthew McConaughey, but in Green Lights, it says, talks about borders and how if you're a creative person, you have to have systems in place. And without them, it's chaotic. So this lecture is kind of about the systems that I use so that my creativity can come out through my dentistry. And these are the two systems that I talk about. One of them is how I take photos. So all the photos that I take, and I don't know if you guys can see, can you see my face or just the screen? I don't know. But either way, I don't know if you can see me, but this is the lecture like handout I gave where it's all the photos I take on every patient. And then the second part is about how I use those photos to talk to the patient and say, hey, I see this change we could make. And I see this tooth is a little short, this tooth is a little long. And then I kind of go from there. So these are the pictures I take on every patient. And I put links at the bottom of each page if anyone like really wants to deep dive, they can. So this is the American Academy of Cosmetic Dentistry. These are the photos that they require for their like before and after. So when you try to become an accredited member of the for cosmetic dentistry, you have to take these photos before and these photos after, and then they score you and they decide if you pass or not. And they're pretty tough, but these are the photos that you have to take. And this is actually one of my first cases I did a couple of years ago. So you have to take the picture of the full face, and then you take pictures, smile, right, left, smile from the front, and then retracted ones. So for these ones, we use a clear retractor on the top and pull the gums and the cheeks out of, or not the gums, but the cheeks and the lips out of the way. And then we use this little black piece to put under their back, under the back of their teeth, so that it can show the contrast if there's any show through of the teeth, like any translucency. And there's like specific guidelines for each of these photos. If you wanted to look more into it, that link would be good. So these are the photos that we take, and it lets you see all the teeth and then every surface of every tooth pretty much. And so those are the pictures we take. So those 12. And then I take these 3 photos, and these all seem kind of silly, but I'll tell you why I take them. And hopefully this is interesting because it should be some part of dentistry that maybe you haven't heard about before. But on the far left is retracted with a full face. So those are retractors. It's all one piece, and it pulls the cheeks off the teeth and lets me see as far back as I can. And this picture is good because I can put the teeth in relation to the face. So if her arch form were to crooked, I would be able to line it up and say, this is how we need to fix it to get it more even. The 12 o'clock photo is pretty interesting. I have the patient put their chin down like this and then look up at me, and they hate doing that one, but it lets me see how far their teeth are tipped, like in and out, like the tip of the teeth or the transverse plane, if you know anatomy. So, and then Duchenne is we have them say shush. And that photo shows us how far their lip can move, especially down, up and down. Because then I plan things differently depending on how people show their teeth. So if someone in their shush photo doesn't lift their lip very far at all, then I may not need to worry about what the gum line looks like. But in this case, in Shayna's teeth, her gum line or her lip line can go so high up that I do worry about what that crown looks like. So in that third photo, she had one crown on her tooth and one tooth next to it. She didn't like those two. So I ended up doing those 2 crowns again for her to fix the aesthetics. And then repose photo, the one on the right, we tell the patient to say Emma, and that's your average lip position. And that tells us a lot about the teeth too. So kind of go into that a little more. I live at the beach, so I like looking for shark teeth. And during COVID, it was like the only activity that I could do. So I found a lot of shark teeth, but I found this quotation I really liked that says, "Fun's looking for variability in things that other people don't notice. It's breaking through boredom and monotony to discover hidden beauty." And I like that because dentistry, if you get stuck in just doing fillings all day or crowns all day or extractions all day, it can get monotonous. But if you are able to educate yourself and learn things like what I'm talking about, it makes it really fun and it doesn't feel like work. And you're able to help people in a way that other dentists might not be able to because you have a broader scope on things. So I like that quotation because it makes things more fun when you look at them in a creative lens and it kind of break through the monotony. So those are the photos I take. And then I'll go into this for like maybe 10 minutes and then we'll go from there. But it's how I design smiles. So I break them down into these 4 topics. And people who are cosmetic dentists that teach, they break these down in different ways. And it's very different dentist to dentist, and no one's right, no one's wrong. So these are the ways I think about it. First, I think about the shape of the teeth and the position of the teeth. And then I think about the proportions. So the proportions of each tooth, and then the proportions of how each tooth fits in the mouth with each other. And then we think about dentofacial analysis, which is where are the teeth, or where's the smile, where are the teeth in regards to the face. And then working our way around, the last thing we think about is color. And we'll probably get to a few of these, and maybe we'll learn about the others another time. Okay. And these are just like statistics that I use every day in practice when I talk cosmetics with my patients. And the studies are at the bottom if you care to look into them further. But these are pretty much the standards of what we want in aesthetics. And aesthetics are weird because everyone, beauty is different, in the eye of the beholder every time. But at the same time, if people are coming to you to improve aesthetics, you have to know what averages are. And you have to respect the averages in order to treat people the best that you can, and make sure they fit within a certain range. Otherwise, you're really doing people a disservice. So, and in cosmetics, you have people coming to you with requests that you don't agree with. And if someone comes to you asking for much longer teeth and it's way further than the average, you have to be able to tell them what the average is. And I measure their tooth and I say, I'm sorry, I can't do that for you. It's too big. And if you don't respect that, then I can refer you to someone else that maybe will do it. But I use these numbers a lot. So tooth display at rest. So that's when a patient says Emma and their lips are at rest. They're not smiling cheese or anything like that. So we want 3 to 4 millimeters of the middle tooth, the central incisor, to show at rest for someone that's 30 years old. And then men show a little bit less. And then every 10 years, we lose a little bit of collagen, unfortunately, in our upper lip. Things start to droop a little more. So you lose about 1 millimeter of your tooth showing every 10 years. So this even comes in handy when we're talking to patients that have dentures. If an 80-year-old has a denture, I don't want them showing a bunch of their upper teeth because it doesn't match the average tooth display or amount of tooth that is age appropriate. So these numbers are pretty important. So the amount of tooth that shows is based off of 3 things. It's based off of the actual where the tooth is, and it's based off of the lip line moving or reveal, the amount of lip movement. And then it's based off of the gums, where the gums fall. If the gums are really big, if the gums are short, that sort of thing. So first, incisal edges, so the tooth position. So we want the centrals to be the longest, and then the laterals, the ones next to it, to go up a little bit and kind of work its way back. So she's actually pretty good to start. This was a before photo. It's pretty good to start with the lengths. And then with the heights, this is one that I use every day. The average height is 9.5 to 11.5. So average is 10.5 millimeters. And in dentistry, you learn millimeters really fast. You can look at something and know how many millimeters it is, but I measure it. And we have softwares now that measure it for us, which is really cool. But 10.5 is your average. And if it's a smaller person, smaller. If it's a bigger person, bigger. And I use that number a lot. This is a tool, it's called a digital caliper, but it measures to the 0.1 millimeters. And I use this a lot. I had this QR code for the lecture I did last week, but this is, I don't know, $10, and it's a really cool tool that I use every day. So this is called smile line. So we do the inner border of the lower lip. We draw a line on it. And then we draw a line on where the edges of the upper teeth are. And we want those lines to be parallel. That's aesthetic, parallel to the lip. And so there's different types. We can categorize them as different types. So normal smile line is the one I showed you. Then there's flat, and then there's reverse. So this is normal. That's the one I showed you. So lower lip line and then the upper teeth edges are pretty much parallel to each other. And this is an example of a flat smile line. So the lower lip is outlined and then the upper teeth are outlined. And then you can see how the lower lip has more arc than the teeth do. So we call that a flat smile line. And then so when you're a dentist, your friends text you nonstop pictures of people and they say, what's wrong with their teeth? And so you have to like answer that all the time. So that's fun. But this guy, Ryan, I think he was on, oh gosh, what is it called? Yellowstone, maybe? And I had people ask me like, what's going on with his teeth? But good looking guy, but it's something about his teeth are off, right? So his lower lip is like this. And then if we draw a line on his upper teeth, I exaggerated it, but you can see it's a reverse arc from the bottom lip. So that smile line is distracting. And maybe one day he'll find me because I talk about him in all my lectures. So those three things determine how much teeth show. And then I'll get through maybe a few more slides and then we'll ask questions. But so then we talk about lip mobility. And I like this one because everyone's so big into like injecting and cosmetics these days, like non-tooth related cosmetics, that I talk to injectors a lot, these girls that are doing lip filler and Botox and all of this. And a lot of times they need to see a dentist for their problem. So lip reveal or lip mobility is the difference between that static smile and a high smile, a full smile. So you can see here, that's her dynamic smile or like an exaggerated full smile. And that's her like relaxed, the M repose or static look. And so that difference is her amount of lip display or reveal or lip mobility. And another average, I always keep in mind, the average amount of lip lift is 6 to 10 millimeters is normal. A hypermobile lip is characterized by 10 millimeters or more of lip movement. So if your lip moves up 10 millimeters or more than 10 millimeters, it's hypermobile. And this one is really important because a lot of people are getting Botox in their upper, you put it right at the base of the nose here on either side, and that prevents the lip from raising. And a lot of people are getting Botox for their upper lip mobility, but they aren't diagnosed with a hypermobile lip, which is more than 10 millimeters. Maybe they have a gummy smile or something like that. And that's actually the case for this case. This is my overall case tonight, is her lip wasn't hypermobile. It was actually other issues that were causing her smile to be gummy or not full with teeth. So here she is again. So a gummy smile, we talk about this sometimes. It means that more than 2 millimeters of her gums show when she smiles. But her lip wasn't hypermobile. It wasn't moving more than 10 millimeters. It was actually that she had too much gum tissue. So that's important in diagnosing and treatment planning. And then an age smiles if your lip's hanging too low. And these are just, I'm just going to kind of breeze through some of these. You don't really need to know the details of them. But I look at, this is next where I look at the gum heights, and her gum heights, I marked on this picture where they should be according to average gum heights. And hers were kind of all over the place. So I knew that we needed to address the gum tissue. And to do that, not to get too clinical, but we actually cut back the gum tissue and then cut back the bone that's underneath it so that more of her teeth will show. So that's where she is now, or where she was. And then we look at the shape of the gums here. And then this is where she ended up. So we did crown lengthening, which is reshaping the bone under the gums, and we reshaped the gums, and we did veneers. And in this case, this is the overlay of the shape of what her gums were before. So I think that was like the big difference that we did. The biggest difference was reshaping the gum tissue. So you can see her teeth before teeth after. So, oh, there we go. And then we look at, I don't want to get too clinical, but like where the highest peak of the gums are on each tooth. And on each tooth, it needs to be in a different place, basically. So these are her veneers. And if you didn't know that I did veneers on her, I hope you wouldn't know that they were veneers. That's the whole point, is to make things look natural. An interesting fact is if someone's teeth are tipped in versus tipped out, flared out, if you can imagine you standing here with a mirror, if I put the mirror up, if I tilt it up towards your eyeballs, the light that reflects off of it is going to be brighter into your eyes, versus if I tip a mirror down, the light that bounces off of it is going to bounce down and up to your eyes, so it's going to look darker. So I use that analogy a lot with patients. When I say I can make your veneers more full from the front, it's going to look brighter. Or on the case on the right, that's actually my sister. We did her Invisalign. So she was flared out, so I needed to bring her teeth in a little bit. And I said, your teeth might look a little darker, just so you know. And they ended up not looking much darker, but I wanted her to be aware that, you know, it could turn out like that. Let's see here. I'll just do this next few slides because it's kind of interesting, like clinically. So the wet dry line is where the outside of the mouth becomes the inside of the mouth. So the outside of the lip becomes inside of the lip, dry, and then wet. So I kind of outlined it here. You might be able to make it out, but maybe look in the mirror tonight on your own lip and see if you can make it out. So there's a line where it becomes wet to dry. And I take this picture because I can see, we want the teeth to fall right on that line aesthetically. And so this is an overlay of where she started versus where she ended up with the veneers. And so I use the photo from the beginning to know I have room to bring her out, to make her teeth bigger, fuller looking without them passing that line. If the veneers or the teeth pass that line, it's too full. The lips don't fit in the teeth don't fit within the lips. But because I took that photo and that line was further out than where her teeth were, I could bring her teeth bigger without crossing the line and be safe. So that's where we brought her. And that's where she ended up. Still looking natural, but I knew we had room to bring her teeth to that line. And this is another way to look at that line. Can I get through this? So I'll kind of end on this maybe. So on the right, or sorry, on the left is her teeth before we did anything. So I take that picture so I can see the shape of the front of the teeth. And that's her upper teeth, and I use a mirror to take it. But so I can see the shape of her teeth. And then in the middle is a mold of how her teeth were from the picture. And the yellow is a template that I use, or my ceramist gives me. And that I lay over her teeth. I put that yellow piece in her mouth. And that tells me the design of what the final veneers are. And that tells me how much I have to shave the teeth down to make room for the veneers. And then on the right side, that photo is after I prepared her teeth for the veneers, how much I shaved down. And I like the photo because I didn't shave a lot of her teeth down for the veneers. I knew that because I could bring her out and add porcelain to the front of her teeth, I didn't have to shave back a lot. I could just be more additive. And that's not always the case, but this is a good example for that. So I'm going to kind of wrap up with that. I don't want to get too far into clinical stuff. Maybe let's see here if I can find a few little slides here. This will be a good one, and then we'll wrap up. So when we talk about color, we talk about these three things: value, chroma, and hue. This is like, you got to know this if you're going to do cosmetic dentistry. So value is the amount of light or dark. And the best way to look at value is to turn something into black and white. And then you're able to see color hue and chroma aside, you can assess the value. So when I am matching shades of teeth, I take pictures in black and white, and I'm able to really quickly identify if I pick the right color of the filling or not. If I'm doing a filling on the front tooth, I'll always take a picture and check it before I finish and do the filling, because I can just look at the value, and that's the best way to evaluate the color. Then we look at chroma, which is the amount of color, like saturation is the way I think about it. And then hue, which is kind of, I think about the tint maybe, but it's the name of the color. And I like to think about crayons because it's, the one on the right is bluer, the one on the left is oranger, or warmer. And these are important if you're doing any sort of cosmetic work, because you have to be able to talk to your patient and talk to your ceramist about colors and what they need to improve to make things match better. So this is where she ended up after we did her veneers and her crown lengthening, which is the gums and the bone lift. She was still healing a little bit, so a little puffy, but much better. And then that's where she ended up. We took some fun pictures at the end. But I will leave it there if you guys want to ask any questions.
Yeah, we'll open up for Q&A. We did get a couple of questions, so I'll read them out for you. So the first question was, any advice for succeeding in dental school?
Yeah, like lean on your classmates and ask your classmates how they're studying and what they're doing. Because a lot of times you might be overstudying for one class and not studying enough for the other. And then same thing with faculty, like go up to and I was terrible at this. I say this because I was terrible at it. Go up to faculty, and if you're not understanding something, ask them. And it's scary, like it's intimidating, but they're there for you. And if they see that you care, then they're gonna give you the time and they're gonna help you learn. Because once you're in dental school, they're looking out for you. They really are. So ask questions to your classmates and ask questions to your faculty, I think would be good advice.
Okay, the next question is, how do you fix the teeth when the gums are too low for the veneers? What happens to the
Yeah,
gum?
that's a good question. So what we do, and also you can maybe look this up too, because I don't have any like pictures of the actual surgery. But you can either refer them to a gum specialist, a periodontist, or you can do it yourself if it's more mild. But you basically cut the gums. You can use a blade or an electrosurge, which is like an electric kind of cauterizing machine, or you can use a laser. And then sometimes you can just modify the gums, and sometimes you have to modify the gums and the bone. And you'll learn more about those measurements and how to take those in dental school. But and then as far as the gum surgery goes, you can either use or the bone surgery, you can use a laser or a drill or like a chisel, and there's different ways to do it. But look, you can look up like gum contouring or gingivectomy or crown lengthening, and those are how you do it.
The next question is, do you ever have people that do not want to pay for certain things? How do you make it work financially and still get them their dream smile?
Yeah, that's a good question. And that's a hard part about cosmetic dentistry, because you want to help everybody, but you have to remember that it's not a right. People don't, unfortunately, people don't have a right to cosmetic services. And I always explain to them too, like, don't lose yourself in this process as becoming a dentist. Like I use this quote all the time. Like I went to Great Clips to get my hair cut until like a year or two ago. Because I didn't have the money to invest in getting my hair done somewhere nice. And now I have the money to get my hair cut somewhere nice and get it colored. And it's one of those things where I didn't need to get it done, but now that I have the finances to do it, I'm able to afford it. And I think once you have that mindset, if someone can't afford your work, then you say, I'm here when you're ready for it. And once in a while, I help people out with that if they're, if they prove to me like, I really connect with them, or whatever happened in their life, I feel for them and I want to help them a little bit, I will. But you can't devalue your work, and you can't negotiate. You have to be set in your prices, and that's going to be based off of your confidence and your training. So I did all this extra cosmetic training, I can charge a little bit more. But then the other point I was going to make was, like, we have payment plans like Care Credit, and there's all these sorts of like credit companies that they can do payments through. So there's options, but insurance doesn't cover it. So you just have to be honest with people off the bat.
The next question is, I'm a freshman and interested in doing dentistry. How did you overcome courses that you struggled in with during your undergrad, and how did you keep yourself motivated to push forward?
That's a good question. That was hard. I mean, like, really hard. I think again, kind of like going to the professors, like if if you get a score back that you're like, oof, that hurt, like show up in their office during office hours or email them, and be honest, say like, hey, like I'm really dedicated to getting good grades here, and I have a path I'm pursuing, and just be honest with them. And it's tough, but it's also it's going to happen again. In dental school, there's so many really hard classes, and you're going to have to talk to your professors. So I always say, like, do that in college if you can. And then like, don't be scared to ask for help, like with like a teacher assistant, or study groups, and find study groups if that's the way and find the way you like to study. I was like, I don't like studying with other people. I like to have music in, and I would have a big old dry erase board in the library, and I was just on the dry erase board all day. Like, I remember doing organic chemistry on the dry erase board all day, just dry erase. And that's how I learn. So just try to figure out how you learn, I think would be helpful.
The next question is, did you always know you wanted to do dentistry?
Yeah, since like middle school. Um, I was like a super ugly duckling in braces. And I also like to use my hands. Like, I'm an artist, and I like to be busy with my hands. And I like to multitask. And I'm trying to think of the things that really like matter now that I'm practicing. Like to use my hands. I'm kind of a people person. I'm not super extroverted though. And then I like how, unlike medicine, you see these people every 6 months, even if they're healthy. So I like that like relationship aspect too.
The next question is, I might feel like a very average applicant. Do you have any tips for helping your application stand out?
I think getting involved in like clubs, I mean, like, your GPA is number one. Like, I've every school's different. I'm not on the admissions board, but I know some schools, they have like their GPA cutoff, and then there's once you're out of that stack, you're out of that stack. They're not even going to care about if you're president of all the clubs. But then I've heard the opposite, where they actually care. I think reaching out to dental schools when you're applying, like going and shadowing at the school, like putting a face to the name, especially like after COVID. Like, I started dental school in 2015. So you could just show up at the schools. And I think for a few of the past years, it hasn't been like that. So I would take advantage of, showing them your face and introducing yourself. And the more they see your name, the more they're going to see you, or like recognize you. And becoming involved in organizations is really important. But if your GPA isn't good, then that's like your number one priority. So
The next question. Congratulations on opening your new practice. What do you think in your career has prepared you the most to open your own practice?
okay, my practice isn't open yet, so let's not jinx it. Um, I'm not prepared. Like I don't think that you're ever going to be prepared to open your own practice. Like I wish I could turn the computer screen backwards to the rest of this table right now because there's just papers everywhere of like the people I've had to like pay or hire or talk to about each step. Um there's some good continuing education courses out there about starting a practice. And when you get to that point, you can do that. But I think too, being an associate for a few years is, especially with the way the business of dentistry is working right now, it's beneficial to be an associate first and not open your doors from day one. That's my opinion, but you're not going to be prepared. You're never going to be prepared for dental school. You're not going to be prepared to graduate, and you're not going to be prepared to open your own practice, but you're ready for it, and you're going to learn as you go. So that's just me being real. So yeah.
The next question is, how can I improve my community involvement section on my application?
Yeah, that's a good question. I think first, like you got to figure out what you enjoy. Like if you enjoy cross stitching or knitting, like get involved in a group that does that. If you involve sailing, get involved in a group that does sailing. My thing that I enjoy is speaking Spanish, and that was my college major. So I looked at groups that were helping out with the Hispanic community. And if you don't know what you're interested in doing, that's a whole other picture. Like you got to figure that out, not just for your dental school application, but for your life. But finding things that you're interested in and then finding things that revolve around that. Otherwise, you're not going to stay a part of that, or church groups. If you're in some sort of philanthropy group, do that. If you have friends that are doing something, just join in like a run club. I was in running clubs, and we would do fundraising events. But finding out what you're interested in first and then seeing if there's other people doing the same thing.
The next question is, what did you look for in a dental school? Did you prefer to stay in state or out?
Yeah, good question. I think when I was applying to dental school, I actually didn't know what I was looking for. I was just, shopping around kind of. And my in-state would have been North Carolina. So UNC or ECU. And I ended up going out of state to MUSC, which is one of the most expensive dental schools out of state. But I saw that they truly supported their students, and their students had a life. Like I toured some schools, and I got into a few schools that when I shadowed or like interviewed, I guess, the students all seemed so depressed and stressed out. And then people were like failing out of classes and having to like retake classes. And then when I toured MUSC, they were talking about the programs that they use to support the students, and how nobody, it's rare, maybe one in every grade has to stay behind a year to catch back up, but their statistics were really good with that. And they were really big. MUSC was really big on clinicals. So I felt like when I got out of dental school, I really could have started practicing right away. I did a residency. Whereas some other dental schools weren't, like they were book smart, but they didn't know how to work on a patient. And this is also something that changes very much year to year between dental schools. So I don't want to say that's how it is now, but that's something to look into is when you interview, when you're getting interviewed by dental schools, you have to remember that first and foremost, you're interviewing them. So if you're interviewing them, you ask them how their students are doing, but you also, when you talk to the students when you're there, you need to ask them questions like, are you happy here? Or like, what is your clinical training like? Do you feel like you're going to be ready to practice? That sort of thing. So interview them, not just let them interview you.
Next question is, what makes you excited about going to work every day?
Oh, that's sweet. I feel like lately I'm like, oh, it comes in waves, right? Um, right now, like my staff has been really incredible. I'm actually filling in at a practice temporarily, and they've been really amazing to me. And then just also being able to answer questions for patients that they can't answer themselves. And then as far as the cosmetic dentistry side, like giving people confidence, like immediate gratification confidence is the coolest thing. There's not many fields that you can do that. So those are some things that make me happy.
The next question is, how do you balance work, social life, and family life?
That's hard. Like, and I'm someone that I think balance is fake. You're never going to be balanced. Um, it's hard. And I don't think that anybody actually has a good grasp on it, but you have to set boundaries. And something I learned just this week actually is that, and this is for dentistry, but life in general, is that you need to figure out each thing that you need. So like friendship, activeness, spiritualness, all those other things that in your life, you need to find a person or people that can help you with those things. And that's something that I'm kind of navigating right now. And then you're able to leave work at work and leave home at home, that sort of thing, or, be more balanced. So yeah, I wish I had the answer to that, but I don't think anybody does.
The next question is, how do you, wait, okay, how did you do research on whether a school is more clinical or research based?
Asking the students that are current students, and then, gosh, there were those, I don't even know what they're called anymore, the websites that talk about the different schools. I don't even remember what they're called. You guys probably know, but it's like you could tell when people are getting in or getting acceptances or not. I forget even what the website was called, but there are like groups talking about them. That's not a good answer, but I forget what those websites were, but I listened to them and I'm sure you all know. They talk about like when acceptance letters are going out, when interviews are going out, that sort of thing. If you don't know, I can help you figure that out, but you guys probably know.
I think like SD, yeah, Student Doctor Network.
Oh yeah, Student Doctor Network.
Yeah.
I like blocked that out of my memory.
There's some also on some Facebook pages, like if you're studying for the DAT, like the boot camp and the booster pages, they also share stuff like that.
Yeah. Student Doctor Network. I was like on that thing every day. Oh my God. But yeah, listening to those, and then a piece of advice, like what I think my favorite piece of advice is listen to every piece of advice, but at the same time, don't listen to any advice. So like have your ears open, know what's going on. And this is like before dental school, during dental school, because everyone is like talking about all these things that you're trying to navigate, trying to figure out. So listen to them, but also like don't take anything to heart immediately, because you're going to learn everyone else is trying to navigate this whole thing too. So don't let it affect your path, but also like be aware. So that's, I don't know, take advice and don't take any advice at the same time.
That was all the questions I got so far, but I'm gonna wait another minute to see if any other questions um do pop up. They do pop up last minute. But on the screen right now is Dr. Driscoll's Instagram and email if you have any questions or just want to reach out to her. Her information is provided on the screen. And then if anybody has any last minute questions, we'll open up the floor.
And if
We'll
anyone's
wait.
too shy to ask,
Yeah.
probably don't email me because I might lose it. But if you message me on Instagram, any questions, I'm here for it. But yeah. Or if you think of something later.
Yeah. If anybody has any more questions, we can. Okay, I actually think that's it. Oh wait,
Okay.
there's one more. Actually, one more. Do you think cosmetic dentistry will become a specialty soon?
Oh, that's a good question. I don't think so soon. we're trying, like, there's groups of people that are trying to make that happen. Because technically anybody can write on their sign, family and cosmetic dentist, because there's no board certification, versus you can't write that you're like an implant dentist, or there's certain things you can't put because it's not a specialty unless you're certified. So they're trying to get it to be board certified, but it's difficult because it's like portfolio based. So maybe one day, but at this point, there's not a board certification. I would love for there to be, but there's a lot of work that's going to have to happen for that to be in effect.
Okay, so I think that was the last question.
Okay.
But thank you again, Dr. Driscoll, for coming on our platform today. It's very informative, and thank you for sharing your journey with us, and sharing advice. And thank you for joining us. For
Yeah.
everyone else on this call, the attendance quiz will be posted later tonight. So just be on the lookout for that on our link tree, which can be found on our Instagram bio, Dental Shadowers. So just be on the lookout for that. But I hope that everybody has a great night. Thank you again, Dr. Driscoll.
Thanks. Bye.
Bye.